We are live. So good morning, everybody. It's a little after 11 o'clock a.m. on the East Coast. It is October 8th, 2021. And I can't believe that we're already to the end of 2021 when I feel like we missed 2020 completely. I am joined on Tales from the Heart this morning with Marty Maron from Tufts. Good morning, Marty.
Good morning, Lisa, and good morning to everybody listening, tuning in, HCM patients and family members. Thank you for tuning in this morning. Thank you.
So it's a big month. October is always a big month, and every 3 or 4 years, it's Summit Month. So let's just start off by saying International Summit 7 is days away. You want to tell everybody what the summit is and how they can register before we get started?
Sure. The HCM Summit is a scientific conference or meeting that typically occurs every 3 years. And it's focused on providing the most contemporary updates in the management, diagnosis and management of HCM by people, investigators and cardiologists with expertise in the disease, who give usually between a 15 to 20, 25-minute talk on a number of different topics over about a 2.5-day period. And really does provide the opportunity for patients and HCM care providers to really, as I said, hear the most up-to-date contemporary approaches to the treatment and management of this complex genetic heart disease. And so it stands as that. And the way it's going to work this time, as opposed to previous years, is it's virtual. Since we're still at the tail end of a pandemic, we're going to do a virtual platform, and means that registrants can sign up for the meeting, which is going to be October, what is it? 15, 16, 17. I'm losing my mind. 15, 16, and 17. That's the weekend that the meeting is occurring virtually. And if you sign up, you can also have the opportunity, if you can't be there for all the talks during that 3-day period, you will have access to all of the material, since it will be archived if you register for access to view at any point in time for the 6 months following the meeting. So content will be there for you as long as you register. If you tune in live, you get to see the live discussions after each talk, just to mention that, which is a Q&A, question and answer period with the speaker. And you can ask questions at that point. That's the, one of the major advantages as well of being there while we do it over the weekend. Sorry, you were going to say something?
I was going to remind people that they also have the opportunity to meet the exhibitors and the sponsors in a virtual, I don't know what we're calling it, virtual exhibit room. And you can talk to representatives from Bristol Myers Squibb or from Cytokinetics or from one of the device companies if you have any questions about technology or what they're working on, et cetera. So you get the investigators, you get the researchers and the clinicians and that content, but you also get to talk to the sponsors and the companies that are behind some of the therapeutics that are being developed.
Yeah. There's going to be, that's a great point. Thanks for bringing that up. I mean, if you go online, you can just Google HCM Summit. You can see all of the offerings in terms of the talks, who's giving them, and also what we're calling industry sponsored symposia that are occurring throughout those 3 days too, which have a lot of number of different really interesting topics and discussions that will occur during those breakout events as well. So hcmsummit.org and then / registration is the webpage to register.
So I want to be very clear with everybody. There is a fee for this conference. It's a very extensive conference and it's very expensive to put on. So I will tell you, I think it's $100 fee for patients, but there's a lot of content there, including what is behind the scenes being called Lisa's 3-hour extravaganza, which is 3 hours of programming from the HCMA, And I do not feature in all of it, which is the best part. We are going to be telling patient stories, and we have little video vignettes from different patients. We have a lot of guest stars. Did you know that Keith Churchwell's coming to the summit?
Nice. It's great.
So I have Rachel Lampert giving a talk on the Live
Yeah.
HCM study and how the HCMA has been a partner. So we've got a lot of fun content. We have calls to action, and we even have a little fireside chat. So Saturday night at the summit is all about the patient. So we encourage you all to participate. I will be live online with you. If you have any questions, if you want to make any comments, we're happy to hear them. So without any further ado, that's our come to the summit. We wish it was in person and we could see you all, but in 3 years we'll be in person. We
Right.
will be in person. Hell or high water, we will be in person. So the HCMA has developed some monthly themes that we try to work around. This month is nationally known as Sudden Cardiac Arrest Awareness Month. So we want to take a moment out to recognize those patients who are at high risk of cardiac arrest. It's our call out to them to bring some attention. Additionally, and kind of pivoting off of that, we've decided to focus on emotional wellness in October. We're coming out of summer months. People are, making those doctor's appointments that they put off over the summer, and they're dealing with their HCM as well as working towards the holiday season and a lot of emotions that are attached to that with family, et cetera. So I wanted to talk to Marty about what are some of the stressors that you see HCM patients facing maybe early in diagnosis or when there's a change in symptoms. Is anxiety and depression part of HCM for some people?
Sure. Yeah. I mean, there's no question that this is a disease, it's genetic heart disease that patients have their whole life and can be associated in some patients with complications, which all that together can weigh heavy, for anybody. There's no question about that. And, for that reason, it's really important that we're having this discussion today about how to essentially be able to, if you're a patient, be able to deal with that aspect of the disease, the weight of what I call usually what I like to say as the weight of the disease, in terms of the fact that a number of different aspects of the disease can weigh on patients, and appropriately so, including these risks of arrhythmias that we've talked about, and of course the burden that comes with this disease in some patients in terms of symptoms, and the impact that has on quality of life can really be frustrating and can really weigh on patients as well. And then there's all kinds of other additional aspects too that come up that can be really heavy, like the chance of passing it to another generation, or having passed it to another generation as well. So a number of different, and then of course, by the way, too, the impact that the disease can have on certain limitations or restrictions of physical activity can really weigh heavy on many patients, particularly those that are younger who were engaged in that kind of lifestyle. And so there are all kinds of different issues here, and all of them, or one of them, or one or more of them, can weigh heavy here. So yes, no question about it.
So there are lots of different ways people can get help, and sometimes some of us might have a problem asking for this kind of help.
Right.
Full disclosure, I have seen a therapist because things weigh heavy. And it's not always easy to separate emotions and process all of the enormity of life in general, and then life with HCM, loss from HCM, and other traumas that might occur in your life. The human experience is not it's messy, and it's okay to get help. The HCMA has programming to do baseline help, which is our discussion groups and our communication on social media. We have trained moderators there ready to answer questions and help guide, and we have our staff. But at the centers of excellence, there are also other resources that you might use. You might use their social worker to help find services. You might be able to tie in with a therapist, a psychologist, or a psychiatrist to get appropriate medications. Marty, you want to talk a little bit about how that might best work for patients to find a mental health professional?
Well, yeah, I mean, I think, well, I'll first say that I think, that, and I'm in this group, I think as cardiologists, or an even HCM expert cardiologists, even though we know and appreciate, of course, the weight that this disease can have on the psychological burden of patients, that I first say that we don't do a good enough job, probably on the whole. I'm not talking about everyone, of course, there's always exceptions, but I think in general, as a group, we could do a lot better at, viewing the patient with HCM as a whole in terms of all these different aspects of care. And the psychological burden is one of those. And we just don't, I think, do a good enough job of raising that issue with patients, addressing it with patients, and of course, executing on getting patients, at times the kind of help that they probably need, because we're not asking those other questions up front enough. And so I think we need to do a better job, for sure. And so I think in terms of the answer to your question, I mean, I think what can be helpful, and this is kind of one strategy, when we've identified, for example, somebody at our institution or an institution near us who kind of stands out as either a therapist or a psychologist or psychiatrist with sort of expertise in, dealing with the burden that comes with chronic diseases, and can help patients, because they've got that expertise, work through these issues in a way that is effective. And so I think my advice is asking your cardiologist first, if they know of somebody that they've worked with who they can refer to in that capacity, whether it's a behavioral therapist, a psychologist, a psychiatrist, and I think you want to, the fit is really important here when you're talking about, somebody to help you with the weight of these issues. And so you really got to find the right fit. And so I think that's why, cardiologists, probably particularly HCM experts, really need to try to do a better job of identifying, kind of a number of experts in this area that could be a referral network for patients to access. But that's the answer. I think I'd start with your cardiologist or your primary care to ask if they know first of anybody who would fit that role as again, in one of three ways: a therapist, a psychologist, or psychiatrist. I think those are your three areas.
Now, we know that not all doctors and patients are good fits. There's personalities. And when it comes to a therapist, I think that's even more intensified, because there's a lot of dialogue going on. You may have to try one or two to find the right one. So don't be discouraged if the first one isn't the right one. You got to look for many of them. I'm sorry, I'm a little allergy today. Getting a little cough, sorry. So we have resources. We know we need to do better. We're encouraging all new centers of excellence to do some mental health evaluations at each encounter with a patient and put that into their practice. And when there's something that's flagged, there's an opportunity to move forward. But I'm kind of calling out patients here to take those surveys seriously. If somebody asks, are you depressed? Or have you felt down and have you not been participating in social activities? Please talk about it. Please admit that you might be limiting your social life and you might be getting a little depressed. It's okay. We can help you get through that if we know that it's happening. So I think the moral of the story here is pretty simple. It's okay to not be strong all the time. It's okay to be vulnerable sometimes. I had to learn that lesson the hard way about 5 years ago. And you have to ask for help. And there's a lot out there. Peer-to-peer support is amazing. We're hoping that in the next year, we're actually going to formalize our peer-to-peer connection. So just having a peer, a buddy, a mentor who's another patient is really helpful as well. So, we have some comments floating in that, wow, we're talking about psychological support. This is amazing. We don't talk about that in HCM. We talk about heart stuff. But I want to pivot a little bit to medications. So if
But I just
somebody
want
wants,
to, before you do that, I just want to again emphasize that point, because I think that's probably maybe in some ways, maybe the most important point that we can convey. And that's, there just simply is no stigma to
no,
seeking help for what is an enormous weight for anybody sometimes, period. There is no stigma to that at all. You just gave the example of, you yourself having accessed that kind of help at one point when you needed it. I've accessed that help, from a therapist. I don't have HCM, of course, but I've done it for other reasons. Okay. And so we all have a lot of complexities to our lives and stress, and HCM, if you've got it, is a huge burden sometimes. Okay? Maybe not always at all times, but it can be at certain moments in particular. So seeking that help is simply not a stigma of any way. And I think we've got to really be absolutely clear about that.
I'm really happy that you shared that with us. That's a little bit of vulnerability that I was talking about. We're all human.
Sure.
We all have our underlying issues that we're dealing with. We all have our personal traumas and our personal experiences that maybe sometimes are a little bit difficult to get through, and sometimes are really hard to get through. We are here as a support community.
Right.
We come together to be able to lift each other up. So let's talk a little bit about medications. Our our medications for mental health safe in HCM? Can they use antidepressants, anti-anxiety meds?
Yeah, I mean, I think just one last quick comment. I just say that, when I sought out that help for challenging moments, in my life in terms of therapists, I got to say that it was tough to make that decision for all the reasons we've just talked about in terms of the stigma and all the connotations that sort of have historically been associated with seeking help like that. But actually, when I did it, and I think you're saying the same thing, I ended up learning so much about myself and sort of how to succeed in a way and cope with not just this one issue that was coming up, but also being able to apply it to all kinds of other issues too. So it opens up doors that, I think in the end, you don't really even would have never realized that you could open up. But you're only going to get there if you step in. Okay. So stepping in, so important. Anyways, so that's that. I just want to kind of finish with that one part. It just really was
No, so now I want to stay here for a minute. So if you would,
yeah,
I'll share mine if you share yours. The process of going and finding a therapist and having those conversations, making that decision, that was really hard for me. It was really hard for me. I help others. I don't need help, which I found out was the biggest bunch of nonsense that I think I've ever told myself. Because I help others, I needed and I deserved to help myself. And that aha moment, like, why will I do this for so many other people, but I won't do it for myself? That was kind of my, what are you, an idiot moment? Like, of course I need this help. And I went and I got it. And I did learn things about why I make decisions, why I procrastinate, why I do the things that I do. And it helped me change behaviors ever so slightly. It wasn't like an aha, my whole life changed moment, but these little things that I changed or how things made me feel when I was confronted with them and how I processed those feelings, I think it made me a more effective member of my family, member of the community. It made me more effective in my work. I think it helped in a lot of different ways that I didn't expect. So it was collateral benefit, if you will. What about you?
Exactly. I mean, that was the point. That's exactly the point is that I've made. I mean, for me, it was just, my mind was cluttered with a lot of stress from, the usual kinds of things and being able to handle the stress of, personal, trying to get career success, with balancing that with, being able to perform personally in a way that I wanted to as well. And just, it started create a lot of cluttering and confusion and stress in my mind. And so once I stepped in and started to talk about that with somebody who could peel those layers away and separate them and make me better understand them and how to cope with them and how to approach them, just as you said, I mean, it opened up a whole set of different doors and in empowering me to be able to be a better really to be a better person, overall. I would never have been able to get there had I not made that decision. And I remember that decision one day. I just picked up I'd been putting it off and putting it off and putting it off, but finally, just the weight of it, I couldn't take anymore, and I made the call. And I mean, I'm so glad that for whatever reason I ultimately decided to do that. But the encouragement here is just to do that, to make that step. The magnitude of benefit is hard to appreciate until you step in.
I think that is fantastic advice. So somebody's made the choice to step in. They're feeling stressed.
Yeah.
They need to go beyond therapy, and medication is recommended
Right.
for either depression or anxiety. I just want to talk for a moment about the safety of using these medications with an underlying heart condition. I know probably about 25% of the HCMA population is on one or more antidepressant or anti-anxiety medication.
Right.
So can you discuss the safety of this class of medication?
Well, I think in general, what I'll say is, again, hard to always talk in specifics because, there could be certain circumstances where, what I'm going to say, may not be applicable to an individual patient or patients, but basically in general, a lot of these therapies or drug therapies for depression and anxiety, are safe and can be used very effectively in patients with HCM. Okay. Some of that, again, depends on other, medical problems a patient may have. And they also depend on what other drugs a patient may be taking, et cetera. But in general, I think the message is that there is almost always a therapeutic option that we can pursue that is not eliminated for that patient because of HCM. That's the point.
And I think that's critically important.
Yeah.
I do feel, based on the topic, that I need to bring up Josh. And I need to bring up the reality that sometimes it gets to be very, very difficult. And sadly, we've had people make the ultimate decision and they end their life because they're stressed, but they didn't get help. So I'm giving a very clear call out to anybody who feels that it's all too much to please reach out for help. There is many, many, many resources for you. The least and the lowest lying is here at the HCMA. We're here to help, and we're here to talk, and we're here to connect you with other patients and provide you those services. Your HCM specialist can help to connect you with mental health professionals. Your local doctor can as well. There's a lot of wonderful things in the world, and there's a lot of stress in the world too. So we're hoping that you balance those off, and please take care of yourself physically and mentally. You can't separate your heart from your head and your head from your heart. You're all one person. And we just feel like it's important to take a moment out of a whole busy year to stop and to talk about this.
That's right. That's right.
Okay. So I'm going to let them ask a couple of quick questions. Both Marty and I have crazy days today, so it's going to be an abbreviated podcast. Not that the topic isn't important, but there's a summit looming, and there's lots of work to be done to get ready for it. So if anybody has any questions, now would be the time to post them. And while we are doing that, I will take a moment to announce that I will be back here at 1:00 today to welcome the newest member of the HCMA Recognized Center of Excellence family, Vanderbilt University in Nashville, Tennessee. So we are happy to welcome them to the team, and you will be able to meet the co-directors as well as the pediatric cardiologist at 1:00 right here on Facebook. So I think we've gotten a number of comments here about how hard it's been through COVID on top of everything else, and how psychological support is definitely needed, especially for those in the transplant pathway. That's a whole separate group. And Ross has put the National Suicide Prevention hotline in the chat area, so you can access that resource as well. Thank you, Ross. So I know it's a hard thing to talk about and we can't get into a bunch of specifics here. So for those of you who are listening, please join us for a discussion group. We had some really robust conversations this week in our transplant pathway discussion group. We had about 15 people in that group. This week, we had a nice newly diagnosed group last night. We actually had a lot of fun last night. So get involved, learn about your HCM, but also take care of the whole you. Marty, thank you so much for sharing those, vulnerable moments with us. I think it's really important for people to see when others are going for help. It's okay. We're all a little screwed up in our own ways. I've not met a completely normal person yet. We all have our things.
Absolutely.
Yeah. I don't want to be normal.
No, I think we should probably come back to this topic again. I think it's that important and perhaps underappreciated in terms of the weight that we give to different topics. We need to continue to have this conversation because it is so critical and so important for so many patients. So I'm glad that you decided to initiate this discussion today. So let's have more for sure.
I think the community would appreciate that. And I look forward to continuing the conversation and maybe bring in a couple of mental health professionals. I might reach out to a few people that I know who do, the psychological impacts of devices, et cetera. And maybe we'll bring them in for some podcasting as well. Right. So everybody, thank you for listening today. Please join us at 1:00 this afternoon for the live broadcast from with Vanderbilt and the International Summit. Yay, we're here. It's happening. It's a year delayed, but it's happening. So please join us for that. It's going to be an amazing weekend. And we look forward to meeting with you all in our virtual booth and seeing you at our 3-hour extravaganza. And you're going to see some faces you recognize and hear from some amazing people, including staff and board members of the HCMA, to prove once and for all, it's not Lisa, it's a team. And we have an amazing team.
That's right.
Thank you all. Have a great day.
Thanks, Lisa. Take care.